Thank you all so much for joining us here today. We wanted to talk a little bit about Medicare and the Independent Payment Advisory Board. I wanted to start out by pointing out a couple quotes I've got here. First, I have a quote of President Obama. Quote, "If you look at the numbers, Medicare in particular will run out of money, and we will not be able to sustain that program no matter how much taxes go up." I mean, it's just not an option for us to sit by and do nothing. And I think we have another quote here. Senator Lieberman. Bottom line, Medicare is hurtling toward its demise. Our government is approaching a cataclysmic fiscal tipping point while Washington is busy posturing for the next election. We ought to be able to all agree that Medicare has to be reformed to save it. We ought to be able to do that. We've come up with reforms here in the House. Our budget, I'm sure that we're about to vote on soon, will have Medicare reforms in it. We've seen a bipartisan Medicare reform with the Ryan Wyden Medicare reform. And we can debate which reforms are best and how we need to proceed in that area. But what we can't do is simply cut without changing the way Medicare works. That's not reform. And that's what the IPAB, the Independent Payment Advisory Board that's in the President's health care plan, does. It basically says, we're not going to reform Medicare. We're not going to change Medicare to save it. We're not going to change the internal workings of Medicare so that it provides more services for less money. We're not going to do any of that. What we're going to do with the IPAB is leave Medicare exactly as it is, and when it starts to run out of money, have an unelected board of bureaucrats start cutting or rationing, depending on how you define it, care. And the end result in that scenario is you will have more and more seniors who can't find doctors that take Medicare. Medicare reimbursement's already significantly below what the private sector provides. And it's going to be even worse if IPAB kicks in. So what the President has said basically with IPAB is, I know we need to reform Medicare, but I don't want to do it. I'll just create this entity, this board, to cut. And we are trying to reverse that here in the House. We're obviously working on legislation to do that. And there's a lot of folks on the other side who are interested, Democrats who are interested in reversing and killing IPAB as well. Representative Elmers.
Thank you, Tim. Renee Elmers, 2nd District of North Carolina. I'm here as one of my fellow freshmen, and I'm also a nurse. I've been in healthcare for many, many years. My husband is a general surgeon, so this is obviously an issue that we are very, very familiar with. What this bill will do is actually serve two purposes. One, it does repeal the Independent Advisory Board, which is basically 15 individuals who will be making decisions for Medicare. What decisions will they be? They'll be what Medicare will and will not pay for. So as a senior goes to receive care, they may or may not be able to receive it depending on what that board decides. So there is large bipartisan support to repeal IPAB, and I think that's an essential piece. The other part, rather than just repealing something, we have to be replacing as well, and that's what we have dedicated ourselves to. And we've said over and over again that it can't just be repealing, but we got to reform. So the other essential piece here is reform of frivolous malpractice lawsuits. Basically, we've said all along that one of the ways that we can improve upon health care is by putting this piece in place. There are estimates of $50 billion a year and up that says that we will save money in health care if we're able to reform malpractice lawsuits. Why? Because physicians practice defensive medicine every day. They order numerous tests because of the fear of lawsuit. Now, we're not talking about leaving anyone unable to be protected in the event that a malpractice lawsuit were to move forward and there were to be true malpractice. What this does is this limits those lawsuits that come forward simply without merit and the costs that physicians and hospitals have to face every day because of it. I am very much in favor of this bill. I think that it is an essential piece. And then, of course, moving forward with hopeful repeal of Obamacare itself. Thank you.
Good afternoon. Sandy Adams, Florida's 24th District. About 2 years ago, we heard the infamous words from then Speaker Pelosi, "We have to pass a bill to know what's in it." Americans across the country were watching, and now they know what's in it. 2 years later, they're finding out. This IPAB board, the board that decides between your care, not you, not your doctor, the board. Bureaucrats who answer to no one but themselves get to decide what your health care will be. Not you, your family, and your doctor, bureaucrats. He also said this would create jobs. It didn't. She also said it would lower cost. It didn't. She also said we could keep our own plans and our own doctors if we wanted. And you can't. I'm here to tell you that meeting with our business owners throughout the district, I was talking to Rick and Brenda Brown, who own several franchises, and they were telling me about the cost to cover their employees now, and the fact that it's going up, not down, and the fear that they have that they won't be able to cover their employees. This is a problem that the American people are facing. It was caused by this bill that was passed without anyone knowing what was in it, as per then Speaker Pelosi's own words. Pass the bill, then find out what's in it. Well, the American people have found out what's in it, and they don't like it. And it's time that we start repealing this piece of legislation. IPAB is one part of it. Let's get the bureaucrats out of our health care. Let's get government out of our health care. Let's make the decisions between a doctor, their patients, and their family. Thank you.
Hello, Congressman Scott Desjardins, Tennessee 4. I don't think that anyone sitting out here today can argue that Medicare is in trouble. We know Medicare is going broke. You can look at a number of different sources to see what number you like. 10 years is a pretty good average. AARP knows this, we know this, and I can say this is not a Republican problem. It's not a Democratic problem. This is a people problem. So for everyone who has parents or grandparents on Medicare, you should be very afraid of this IPAB bill. We set forth as a responsible means of fixing Medicare in the Ryan budget. We all know, we can agree on the facts that Medicare is going broke. We have a plan in place that will start to correct and preserve and protect Medicare for future generations in the Ryan plan. But instead, we're villainized for that. We're accused of literally pushing grandmother off the cliff. And clearly, that is the kind of demagoguery we don't need when we're trying to take care of our seniors' need and access for care. IPAB was brought to the forefront by my good friend and fellow physician and colleague from Tennessee, Dr. Phil Rowe. And as several of my colleagues have stated, this is a board of bureaucrats that's designed to put a Washington bureaucrat between the patient and their doctor. That's not what any of our seniors want, and it is tasked with helping gut $500 billion from the Medicare program. And this is going to take place in the form of rationing of care. They can say that it isn't, but it is. It's going to take somebody who's in need of a test and have a board decide whether or not that test is appropriate. That's not the direction we want to see Medicare going. So repealing this IPAB is extremely important, and it's been a bipartisan effort here in the House, and I really hope that we can move in the right direction and get this legislation passed and protect our seniors now and in the future in terms of their access to care. Representative Nunley.
I'm Alan Nunley from Mississippi 1. About this time last year, the House of Representatives passed a budget, and in that budget we laid out a framework for future debate and discussion on how to deal with our enormous national debt and the Medicare problem that's driving a large portion of that debt. When we passed that budget, the result was the other side didn't want to discuss the issue. They just made commercials of Chairman Ryan pushing seniors off a cliff. Well, over the next 2 weeks, I hope we're going to be able to continue to have discussions. Those who only want to deal with sound bites and demagogue the issue have not put forth a reasonable alternative, nor have they put forth a reasonable defense of the status quo. Right now, the status quo is cutting $500 billion from Medicare beneficiaries, $500 billion of payment for health care that will result in rationing, that will result in patients not getting the care they need. The status quo will also result in an unelected group of bureaucrats making decisions for health care for people in North Mississippi. I don't think either of those things are good. So I'm hopeful that we can continue this meaningful discussion on reform of the Medicare program while we will protect existing recipients. We will also make sure that the program is there for their grandchildren. And then we will also repeal this unelected group of bureaucrats that stand between patients and their doctors.
Thank you all for being here today. My name is Randy Hultgren, Congressman from Illinois 14. It's 2 years from this Friday is when the health care bill first passed. And it's absolutely true. Now we do know, as Nancy Pelosi said, we know what's in the bill. And there is so much in there not to like. One of the greatest things that I have a very serious problem with is the IPAB board. Unelected bureaucrats deciding the care that our seniors will have access to. We can tell from how this is written that it will absolutely limit access to care. And it really limits it on two fronts. One is the board can decide what type of treatment can be given. The other that isn't spoken about so much but needs to be discussed is the cuts that happen in this, any savings that happen, only happen by reducing the amount that's paid out to physicians. I'm hearing doctor after doctor, physician after physician saying, I can no longer take any new Medicare patients. I have to limit the number of Medicare patients that I have. So what good is it for someone to have Medicare when they have no doctor who will be able to see them? That is limiting access. It is limiting care. We need to turn it around. We need to do the right thing and fix Medicare for our seniors, for our future. That is the work that ought to be done. This was the wrong direction. I also think there is an important step that we take this week, and that is addressing the real problem of lawsuit abuse and the high cost that is inflicted because of lawsuit abuse against doctors and against hospitals, and the amount of defensive medicine that goes in and how we all pay a price for that. It drives up our cost of care that we can have and that our seniors can have. Let's talk about that. Let's address that. Let's do all that we can to address the real problem of healthcare, and that's the cost of healthcare. Make sure that the patient can still see the doctor that they want to see and not have a board of bureaucrats determining what kind of care they can receive. This is what we can do if we come together and work together to fix Medicare. I hand it over to Mike Kelly. Thank you.
Well, it's great to see you all, and this certainly is a special week in Washington. I'm fortunate in that I have a group of senior advisors back home in Northwest Pennsylvania. Those are the people that I talk to every day. And those are the people that really we're talking about here today, and we're talking about doing something to them that they didn't envision and they quite don't understand. And so as we sit here this week and we watch the cherry blossoms, I'm told they're going to peak, I think, Wednesday, and then they'll start to decline. Well, we also have a group of citizens out there that have peaked, and now they're in their decline. And my mother-in-law, who's 86, is here. Janice Larrick is here, and her husband, Harold Larrick, is here. She's 86. Harold's 88. Big Tom Bernatoski, who I see every morning back home, have a cup of coffee with him, and Gene Tennis. These guys are both veterans of the wars. They've paid their dues, and they know they did everything they were asked to do. They paid the price. They played by the rules. But they're trying to understand why now. Why at this time in their life? Why are they being robbed of the most important thing our seniors should have? And that's peace of mind. After you've worked your whole life and you think you've paid into a program, you think, you know what? I'm pretty safe now. I'm coasting. I'm getting towards the end, but I'm going to be taken care of by the government because I've always paid into this program. Well, let me tell you, they're starting to find out what everybody else is finding out. Not just Republicans, by the way, but there's Democrats that are saying, maybe we should have read it. Maybe we should have looked at what was coming. This IPAB, what is that exactly? What, an independent payment board? They don't answer to anybody? Not elected, but appointed? Don't answer to Congress or to the electorate? Can pretty much do anything they want to do? Now, we already know that Medicare under its current model is not going to last. All we're trying to do is fix it. That's all we're trying to do, fix it. Keep that promise to the most vulnerable part of our population, our seniors who have worked the hardest, fought the most, done everything they could to preserve this great country. And now at this late date, we're going to penalize them? No, not on our watch, not in our time, not now, not in the United States. We will repeal this. And we'll have people on the other side who voted for it, but now we'll say, you know what? Probably should have read it. Probably shouldn't have listened to Ms. Pelosi. Probably should have read it first. Probably should have tried to understand what it was going to do to those people who I represent. And we're going to fix it. We're going to look at these medical malpractice suits and say, is it a little bit crazy where we're going with this and how it's directing people to make decisions they go into the future. You know what? I'm not going to be able to handle Medicare patients. And you know what these people are telling their sons and daughters? Maybe this isn't the right profession to you go into either. And folks, we're at a really pivotal point in our history right now where we have to take a look at what government's done to hurt its citizens. This program has hurt them deeply, and we need to repeal it right now. So I thank you for being with us, and I thank my colleagues. Dr. Harris, you're going to speak on this issue also. Thank you so much.
Thank you very much. The Independent Payment Advisory Board was devised for only one method and one method only. It was basically to restrict benefits to Medicare beneficiaries and therefore reduce the cost of Medicare so that money could be spent on the rest of the Affordable Care Act. But only in Washington could you design a system that would use 15 unelected people, by law, a minority of them being healthcare practitioners, by law, none of that minority being active practitioners, to actually decide how healthcare is going to be delivered to our seniors. That's the opposite of what our seniors want. As Dr. Desjardins said, our seniors want that decision about healthcare to be made between a patient and their physician. That's it. No one looking over that shoulder, no one deciding whether in that individual case that's appropriate care or not. As Representative Elmer said, this is going to be coupled with tort reform, and it's about time. I was an obstetric anesthesiologist before I came to Congress, spent 30 years on the labor and delivery suite, and the change was dramatic, all driven by the tort crisis in the United States, where there were no more senior obstetricians. They all left the practice of obstetrics. All the groups were 8 or 9 obstetricians, so a woman going for care didn't develop a relationship with a single obstetrician, but a large group. And finally, the cesarean section rate in the country went up to close to 40%, all as a result of the lack of tort reform. So it's about time we take that up in Congress. We sent that bill over to the Senate a year ago, and the Senate, in its usual course of inaction, took no action. Well, this time when we send that bill over, they'll be forced to at least consider tort reform so that our citizens can have access to obstetrics and neurosurgery in parts of the country where they don't have access to that right now. Thank you.